A case from Chapter 5 on the hip. This is Meralgia Paresthetica. Conflicts of interest. I am a stockholder and a speaker for Sonics Health and co-editor with Dean Ziegler of a textbook on MSK UltraSound for orthopedic surgeons. This is a case presentation. This is a 64-year-old male with anterolateral left upper thigh pain. He's had a previous nerve injection, but recently this pain has been reawakened by another injury. Our technique we will use the linear probe as we use on the shoulder, place it in the transverse or short axis of the body. The lateral end is placed near the ASIS, and the medial end is aimed somewhat inferior toward the symphysis pubis. In this way, we find the inguinal ligament. The nerve should be just deep to the lateral end of the inguinal ligament. In our technique, we're going to use a 22-gauge needle and inject 2 mL of lidocaine and 40 milligrams of Kenalog. Here is the anatomy. We see the inguinal ligament running transversely across the screen, and on the lateral side, we see that we're not looking at the bone of the ASIS. We've brought the end of the probe slightly inferior so that we have some soft tissue to pass the needle through. And in the center of the screen is the lateral femoral cutaneous nerve. So here's an example of approach toward the deep side. I like to approach nerves sort of obliquely and do a hydrodissection along one border of the nerve. There are the muscles coming off the ASIS, and our inguinal ligament is above, and the needle is coming from the lateral side, and we'll see it go to the deep surface of the nerve, and we'll do a hydrodissection with our lidocaine Kenalog mixture. The needle should then be brought out to just outside the deep fascia and repassed in a different direction. Here we see the needle approaching the superficial side of the nerve and hydrodissection. The final result of this injection was complete relief of pain and other symptoms in just a few days, and he has not returned to our clinic in over 18 months. Thank you for your attention.